something that people have completely missed about what happens with injury is something that I discovered over 40 years ago and has been verified by scientific investigation since. So for example, I want to show you something here with Lisa that's very specific about how she might have injured herself. So when I look at her knees, for example, what we can notice here is that there is a difference in the size of her kneecaps. Can you see that, Lisa?
Yes.
Yeah, see the difference? Okay.
Yeah.
So there's a enlarged kneecap here on the right, and you can actually see the difference in the size of your knee here at the end of your thigh bone, okay? And we can actually measure those differences. And people have wondered for many, many years why these changes happen. So for example, your kneecap on this side is 47.6, and the kneecap on this side, you can see, is 50.3. And then the actual bone at the end of the thigh bone here is 82.9 compared to this one, the same spot, right, which is 89.7. Do you remember doing something that maybe when you injured your knee?
Yes, I fell hard on my knee last year.
Okay, yeah. And you remember that.
Oh, yeah.
And what did you notice since that time in terms of how things are working in your body?
Well, I don't have much knee pain, but I have a chronically tight right hip.
Okay, so you notice that change, okay?
Yeah.
All right, so let's look at what happens here, because that's just the tip of the iceberg. And what we discovered and what science has proven is that the entire thigh bone might have been injured, affected by that injury. It goes right into the bone. It's a very dense tissue, okay? And so now all of the muscles and ligaments around the thigh bone are going to be affected. So for example, when I test the tension in your thigh muscle here, just notice how tight that is, right? Okay? And what do you notice when I press on this one here?
It's looser.
It's much looser,
Yeah.
isn't it? Yeah, so there's a big difference here, right? And so all of that's going to change the way your thigh works, for example, where your knees work, and it can even influence other things, as we'll show you afterwards, okay? So this is a huge difference that no one has really identified before, and why this process that we call matrix repatterning is really a different way of looking at the body. And when you start to look at these things for yourself, you'll discover that these types of changes have happened throughout your body. So another example we have here with you is a very common injury of falling on your shoulder. So I'm going to get you to just notice the difference. Lisa, just look at the size of your upper arm here on the left side, on your left, compared to your right side. You see the difference?
Yeah.
Right. There's quite a big difference in the size, and we can see that difference there, and we can actually measure those too. But the reality is, these are the kinds of things that everyone has experienced. So falling on your shoulder, on your wrist, on your knee, on your hip, and even on your head changes the way bone is affected. And bone enlarges. We now know that's been verified by studies at the University of California. Something I discovered over 40, almost 45 years ago when I was in school, and noticed that when I was doing dissections and looking at x-rays, and always wondering, why is the bone on one side bigger than the other? And we now have an answer, okay? And the difference with this process is by actually changing the shape of your bone, which is quite a big breakthrough, we can actually restore the function of your body in so many ways, okay? That's what we're going to be able to show you today.
Okay.
Okay? So let's look at Lisa from this perspective. And one thing we now know about the body is that there's a molecular framework inside your cells, which we call the cytoskeleton, okay? And that when there's an injury in these cells, the actual cells expand. And that's why we actually see these changes in bone, for example, which we didn't know before, okay? And that becomes, instead of a nice flexible state inside your cells, becomes an expanded and rigid state. And that can cause all of those other tension patterns to develop in that one area. So when the structure is injured, like in the case of the thigh bone here, we know that the cells expand and prevent electricity from flowing. And this is the idea of that static charge building up, right? And so in order to release that static charge, we actually do something without even thinking about it. what do you think you do when you bump your knee or your elbow? What's the first thing you do besides yell, ow?
I put my hand on it.
Yeah, exactly. So this is something I discovered many, many years ago, is that there are certain parts of the body where there's a lot of nerve endings, and that those nerve endings produce a field which, if you place that electrical field over an area that's injured, it actually helps to relax some of that tissue because it actually dissipates the charge. Same thing if you have static electricity affecting your hair standing up on end, if you just put your hand on top of it, it'll start to smooth down. You're actually releasing those static electrons, aren't you? You're grounding them, okay? So we've actually discovered technology that works even better. So over the years, we've developed technology. There's a very specific device which we call the Matrix Repatterning Scanner. And this is a device that's a very powerful magnet, but a very specific type of magnet, not a regular magnet, but a magnet that has these alternating polarity rings in it, okay? We call it an alternating polarity concentric magnet. And that has an amazing effect on allowing for the release of electrical charge in areas that are injured. A big part of the matrix assessment is looking for injuries that affect the nervous system. And an area that we've investigated quite a bit and done a lot of work with is the area of concussions. And so common injuries to the head, facial areas like the jaw and so on, but even injuries to the trunk can be transmitted up through the spine into the head. And one of the things I noticed with Lisa is there are changes in the shape of her head that may indicate a specific type of injury, okay? So I can see there's a bit of flattening in here, for example, and over here. And because of that, there's an expansion around this part of her head, around this ear. So I'm going to ask you, Lisa, how it feels when I poke around this area here.
It's tender there.
Tender.
Yeah.
And I want you to compare the other side.
That's not as tender.
Not as tender. So this area can affect things, for example, like the hearing function. It can affect your equilibrium because it controls this bone inside. There are mechanisms that affect our equilibrium, okay? And so that may be an area where people have issues like ringing in the ears or hearing issues or even problems with dizziness. Okay. Do you experience any of those issues?
Yes, I do.
Yeah.
Hearing in this ear.
Hearing in that ear.
Yeah.
Perfect. Okay, so we often see this connection between an injury and the types of conditions that people are experiencing. We connect those dots. That's really important. Okay, so let's have a look at how that injury may be affecting her entire body, because the nervous system really is a high-level control for the entire body. And when there's injuries to the head or the spine, that can change everything. So let's look at the overall muscle tone in your thigh on this side and compare it to that side. We know there's a little bit of a difference already, okay, because there's a local injury. But let's look at the calf muscles, okay? So feel that one compared to that one. Can you feel the difference?
Mm-hmm.
Yeah, there's quite a, what do you notice?
This side, my right side is firmer than my left.
Exactly, okay? And let's look at the arm muscles as well, same way, all right? So we're going to test your forearm muscle like that, just a general test of your tone. And let's compare it to this side. Can you feel?
That's much firmer.
Much firmer
Yeah.
on
My right.
your right,
Yeah.
okay? So let's look at your bicep muscle here, nice and soft here. How does it feel when I press here?
It's firmer.
Very
on my
tight.
right.
So everything on your right side is tighter, isn't it? Okay. So let's try something, and we're going to neutralize what I call a high-order neurological injury to your head. All right, we're going to place the scanner just under your head where that injury occurred. Okay, let's look at these muscles again and see what happens. All right, let's start with your calf muscles. Okay, so just feel that, and I want you to compare both sides now.
They feel more even.
Even,
Yeah.
yeah. Okay, good. So that was a pretty obvious one. And the thigh muscle, remember how tight that was before?
Yeah, that's softer.
Softer, right? And
Yeah.
see how they're a little more equal now, right?
Mm-hmm.
Good. And the same thing right through here, right? Little,
Mm-hmm.
you notice?
Little softer.
Yeah. And just feel the difference now.
Yeah,
Okay.
that's more the same.
Yeah.
Yeah.
And what's interesting is that kind of balances out, okay?
Mm-hmm.
So for example, if we don't treat that area, many of the other things that we're trying to treat may not be as effective. And so as a matrix practitioner, what we look at is what is the order we need to treat in. And we identify those and we treat accordingly. And that's what a certified matrix repatterning practitioner is trained to do, is to determine where the most significant injuries are and treat those in the right order. You may have experienced the fact that when you move a certain way, you feel pain, or if you bend over to pick something up, your back gives out, or climbing stairs or twisting, you feel your knee is going to give out or something like that. This illustrates another very important concept within matrix repatterning, and that has to do with joint instability. Joint instability is something that literally can take you out. We've heard of many people, like famous hockey players, whose careers ended suddenly because their knees gave out, okay? Or people who've had chronic degenerative changes in their low back, for example. So joint instability can come into that and play a major role. So let's see how we can identify those areas and actually potentially correct them using matrix repatterning. So let's have a look at her knee stability. I'm going to do something called a stability test, or a drawer test on her right knee, and I'm pushing back this way to see if there's any loosening or weakening of the stability within the knee. Then I'm going to be stabilizing here on her foot, like so, and then I'm going to test it this way to see if there's any issues here. And Lisa, tell me what you notice when I do that with your knee.
That feels looser.
Looser. It feels kind of a little bit wobbly.
Yeah, it feels like it's moving.
All right, let's compare it to this side. We'll do that one first, which is the anterior stability. And now when I do this one, can you feel the difference? Mm-hmm. It's not quite as loose. There's a little bit of an issue there too.
Yeah, but not as much.
Not as much, okay? And we'll test the other direction here, right? Actually, this one is a bit of a problem this way, isn't it? Mm-hmm. Yeah. Okay, so we have issues here. If you have instability in the knees or any other part of the body, we know that this can add to the wear and tear on those joints. What I'd like you to notice now is how this specific muscle group feels when I put pressure on it. Can you feel the tone there? Mm-hmm. Okay, so that tone is actually one of the muscles that controls the way your knee is moving moment to moment. So what I'm going to do is identify an area that might be affecting that. And what I notice in here in your thigh, there's another injury up in the hip area, which also might be affecting your hip. And if you notice, when I put pressure here, and you can put your thumb and fingers on this side, Lisa, just feel the size of your outer part of your hip, okay? And I want you to put your thumb and fingers on this side and notice.
Oh yeah, that's bigger on my right.
Much bigger, yeah. What we've identified here is this outer part of the hip called the greater trochanter, which you can see is bigger and it's more sensitive. Can you feel how it's sensitive on that side, right? Yeah. So is it possible you might have fallen on that hip?
Oh, for sure.
Yeah, okay. And so we compared that. So we identified that as an injury. Now, what's important about that kind of injury and even falling on the knee is how that can influence so many other structures, because that force can come into and affect the hip and the low back and so on. So your issues in your hip might also be contributed to by that injury, okay? So what we discovered is that this type of injury can actually cause the body to start turning off the stabilizers in other joints. And I kind of questioned, like, why does that happen? And my feeling is that the body is trying to protect some vital structures like the spinal cord and the internal organs. And so it doesn't want more strain to be introduced. So I talk about joints being sacrificed. We call the knee a sacrificial joint for that reason, because the body will actually cause that to become wobbly so that more strain doesn't come up and potentially damage something like your spinal cord, for example, okay? So if we then go ahead and neutralize that hip injury here, okay, just by placing the scanner there, okay, let's see what happens to your thigh muscle, okay? So I'm just placing it over here, and now I'm going to go ahead again and retest that thigh muscle, and tell me how it feels now compared to before.
That feels not as soft.
Right. It feels more firm.
More firm.
More firm.
Yeah.
It's interesting.
Yeah.
It kind of like turns it back on.
Mm-hmm.
Now we'll take it away. Okay? Give it a few seconds and notice what happens to it now.
Mm-hmm. It's softer.
It's softer,
Yeah.
softens up. So this is kind of opposite to creating a source of tension. That's because the nervous system interprets this injury as perhaps threatening to vital structures, and it will turn off some of those muscles, okay? That can also apply to your hips and low back and even the shoulders, okay? These are areas that we've identified as sacrificial joints that the body will literally turn off and are often mistaken for ligament injuries, or in the case of the low back, disc injuries, okay? Let's place this scanner on your hip to neutralize the effect of this injury and see what happens. We're sort of tricking the body into thinking this is okay now. Tell me what you notice now when I feel the tone in that thigh muscle.
It feels firmer.
Firmer.
Yeah.
Okay, good. Now let's take it away, okay? So we'll give that a few seconds, and we're going to recheck that muscle tone again, okay? So notice what happens now.
It's softer.
It softens, yeah. So this is a kind of an interesting phenomenon where literally by neutralizing one injury, we're kind of giving the body new information that allows it to turn back on those stabilizers. And if a joint is unstable, it's going to start to break down. That's wear and tear, isn't it? But if it's stable, it'll actually be able to function more normally. So if we test your stability in this direction, you can see where that's kind of wobbly. You can sort of feel that kind of movement.
Mm-hmm.
And I'm monitoring the movement of your lower leg here, the tibia. So now we're going to place the scanner over that hip injury, right? And we're going to retest it. Can you feel that?
Yeah,
It becomes more solid, exactly. So you can imagine if it's kind of sloppy movement, what might happen to your knee compared to when it's stable,
Mm-hmm.
right?
It could give out.
Yeah, it could give out and cause wear and tear,
Mm-hmm.
right? And that's where we see a lot of joint breakdown, degeneration of the cartilage, the meniscus, all of these things start to break down. And the same happens with, for example, your low back, okay? So what we need to ask at this point, does it make sense that this is a torn ligament that's causing that? Because what we've seen before is people actually schedule for surgery for a so-called torn ligament. When we've corrected issues like that, they go back and they get rechecked, and the surgeon goes, what's going on? This is perfectly normal. There can't be a torn ligament. And what they've done is they've misinterpreted that response, thinking it's the ligament, when in fact, joints like the knee actually depend on muscle tone to create stability, all right? So there are several muscles that can influence the knee that way, all right? That's one of them. In fact, having an actual torn ligament is extremely rare, and that causes, bleeding inside the joint often and a breakage of the bone inside the tibia, when in fact, in most cases, it's simply this muscle imbalance created by other injuries. And by identifying those other injuries, we can turn the stabilizers back on like flipping a light switch. And we've seen many cases where surgery has been avoided as a result. Another major condition affected by joint instability is the low back. So let's look at the skeleton here for a moment, okay? So where we see a breakdown in the discs in the spine, it's primarily focused on the lower lumbar spine. And what's different about the lower lumbar spine compared to higher up in the spine is that the spinal cord is present in the entire spine, but it actually ends about here. Below this, there are actually individual fibers that are much less vulnerable to injury of the spinal cord. So what the body does to protect the spinal cord is it'll often turn the stabilizers off in the lower lumbar spine, and unfortunately that causes a breakdown in the tissues, things like the disc and so on, and people wind up needing low back surgery. So for low back conditions, we often look at what is causing that instability in the first place, and it's often other areas that the nervous system has identified as more significant injuries, and in order for us to restore the stability here, we have to identify those. If there's constant stress on the discs and the ligaments around the low back vertebrae, it literally cannot heal. It's similar to you cutting your arm, and then if you were constantly tug at the tissue around the cut, it would never heal. That's the same thing that happens with an unstable joint. Okay, stability is the key to allowing it to heal properly. The question is, how can we restore that stability? Let's look at the low back to find out how this might be affecting a situation here, okay? So let's look at the muscles along the spine. I'm going to be checking the little stabilizers. There's little muscles along the spine that protect the spinal cord, and they're constantly in a state of nice, solid tone, okay? And they protect the spine from excessive movement and therefore breakdown of the discs. Okay. Now, as we get down, lower down here, Lisa, what do you notice as I get down into this area here compared to this area? Can you feel the difference?
Yeah, it feels softer in there.
Yeah, kind of mushy and maybe even a little vulnerable. Do you feel that?
Yeah, a little painful.
A little painful. Yeah, exactly. So that's really soft. Okay. So what we identified with Lisa are a couple of other injuries. For example, she has quite a significant hip injury on her right side here. So let's do something. Okay, so we're going to stay on those muscles. You can feel they're kind of a little mushy and a little sensitive, right? Okay. At the same time, I'm going to place the scanner over that right hip. Okay. So what I'm doing is I'm tricking the body into thinking this is okay now. All right. So literally restoring some normal kind of function here. So now I'm going to go back and I'm going to recheck those muscles now. Tell me what you notice now.
They're firmer.
Much firmer. Yeah, more comfortable maybe?
Yeah, not as pokey.
Yes, exactly. All right. So you can see clearly why I might want to fix the hip area and the femur here, and to allow for a restoration of stability here, which might allow for an improvement in your low back. Does that make sense?
Yes.
Okay. All right. Okay, so let's take that away again. And again, you'll see the difference perhaps here. Okay, now without that normalizing influence, just notice what happens again.
Yeah.
What happens?
It's more sensitive and it's mushier.
Mushier, exactly, right. So you can see how we can literally turn on the stability, and the scanner allows us to actually determine where we need to treat in order to do that, okay? And so far, all we've done is assessment. One of the key features of matrix repatterning is we can literally demonstrate how an injury in one part of the body can cause problems in another part of the body. We talked about tension being transmitted, but when certain injuries are present, it can literally cause a reduction in the tone, which leads to joint instability. And joint instability can be affecting things like the low back. We talked about the knees. It can affect the hips and the shoulders. Restoring stability in these areas is really crucial because that will not only allow for the body to heal more effectively, it'll prevent re-injury. All right, this is why joint stability and restoring joint stability by correcting the source of the problem is such a key element of this process. Another overlooked area of the body in terms of responding to injury is what happens to some very dense parts inside the body that are fluid-filled organs. And inside our body, in the trunk, in the abdomen, in the chest, for example, the abdomen, we have the liver, spleen, kidneys, and so on, the heart in the chest area, and the head is not only a bony structure, it's also a fluid-filled chamber because the brain itself and the surrounding fluid are very much like a fluid chamber. And what we know about fluid inside the body, like water, it's a very dense substance, and when there's an impact or a fall, these organs can expand rapidly and put a lot of stress on various areas of the body, including the rib cage, the spine, the pelvic area, and even the head. And this is one of the reasons we think issues like concussion and so on are such an important component of what happens inside the body. With matrix repatterning, by releasing the tension around these fluid-filled structures, which includes correcting the bone structure in the pelvis and the rib cage, the spine, and the head, we can actually restore normal function. So we've seen that with neurological tests for concussion. We've seen that in heart function, digestive function, liver function, and even pelvic disorders, things like painful periods, erectile dysfunction, incontinence, which is leaky bladder, and so on. Many people experience that kind of improvement as well. Another common issue we hear about are problems with snoring and sleep apnea. So I want to ask you, Lisa, have you been told that you sometimes snore?
Sometimes.
Yeah, okay.
Yeah.
All right. So one of the things we often see with this are areas of tension, as we identified earlier, in the neck muscles here, and another area where the tongue is supported, and it tends to be very tight. And so what happens when you relax into sleep is that tends to pull the tongue down into the airway, causing it to act like a cork, all right? And so what we can do is by identifying certain areas internally that might be causing tension elsewhere in the body, like for example, even your hip, we recognized that this was a big injury, right? And other areas that might contribute to it are in the rib cage and chest. So for example, if I place these two here, we actually will reduce some of the strain that's pulling on these tissues that cause the tongue to be pulled down as you relax into deeper sleep. And so now, just notice how those neck muscles feel now, all right? All right? And just feel how easily I can move that little bone that anchors the tongue down, right? Feel that? Now, if I take these away, and I'll try to move that bone again, you can see how it just tightens right up. Feel that? So that you can feel how that might be pulling that down. So this is one of many tests we do to determine what might be causing things like snoring and sleep apnea. Matrix repatterning treatment is about identifying the source of the tension, even though this may not be the painful area. So for Lisa, she had problems in her hip. She noticed issues maybe in the neck, for example, that were under tension. We identified the fact that her range of motion, for example, in her shoulder was a little bit restricted, like so. Then by scanning the body and precisely locating sources of tension, as we found in the thigh here, we can help you understand why we might treat an area here that might influence other areas of the body, right? So treatment, we're going to apply a normalizing electromagnetic field using the scanner, and we're going to combine that with gentle pressure, and we determine this through a very precise process of assessment to telling us exactly where to treat and how to treat it. All right, so I'm just going to apply a little bit of treatment here. We're just going to do a little kind of a mini treatment here. And you can see it's extremely gentle, right? Okay, but it actually is causing that movement of electrical charge, which we call piezoelectricity, which releases the source of tension here in the thigh, okay? And I'm just monitoring that as we treat to see if there's a little bit of a change. And that change, even though it's gentle, is often lasting and even permanent change in the bone structure. And if we were to carry through this treatment, we'd actually see the change in the bone size measurably, which we've done before and even measured on x-ray. We've done a little mini treatment in the thigh. Let's see how that has influenced the range of motion, for example, in the shoulder, right? You can feel the difference, see the difference, right? You can see how the range of motion, internal rotation is a little better now as well, okay? And we can check even here in the neck muscles and see that there's a little bit of an improvement. So these are the kinds of changes that we can see almost immediately after treatment to help people understand why we're treating one area of the body to influence many other parts of the body. You might ask, how can such a gentle treatment, which is extremely gentle, right? You can feel how gentle it is. How can such a gentle treatment create such a permanent and lasting change in the tissues? And I'll use this analogy of this plastic water bottle, okay? So injuries took a lot of force to create. You've had falls, you've had bumps, you've had severe strains, and the question is, how can such a gentle treatment do that? Well, if you think of this water bottle, okay, as a fairly stable structure, it takes quite a bit of force to change that structure. Okay, you can see how that's been absorbed into the water bottle, and by precisely locating the areas where that was trapped into the bottle and applying a relatively gentle application of pressure, we literally can restore the shape of the bottle. In the same way, we restore the pattern to your cell structure. And because the inherent structure is always there, it's been there from the beginning, it literally just requires us releasing the tension that was stored, identifying them in all the places of the body that may have been affected by injury, and allowing the body to come back to its normal structure, normal size and shape, restoring cellular function, improving joint function, improving muscle tone, flexibility, stability, and even things like internal organ function, improving issues to do with concussion, traumatic brain injury, because the shape of the head, for example, in your case, we identified areas that were affected, that can reduce stress on the nerves inside the head and other areas of the body as well. What you may not realize is that your entire lifetime has been a series of different incidents where your body has absorbed injury like this layers on this toy here. And we can see that you may have several injuries that brought you to a place where you had symptoms, and correcting one particular layer exposes other layers of injury eventually that can be treated one at a time. And in fact, some of these injuries could have been quite significant, where, for example, you may have had one injury that made you more vulnerable to other injuries, and you can trace it back as you continue through the treatment process back to the earliest injuries where you might have had a birth trauma, fallen off a piece of equipment as a child, fallen off the changing table. All of these injuries will eventually be identified and addressed. And therefore, matrix repatterning is a way to restore function, to literally restore the pattern that was originally there. In this way, we can provide a relief from a lifetime of injuries that have occurred. And a certified matrix repatterning practitioner is trained to precisely locate the source of these injuries and address them gently and provide lasting benefit in terms of pain relief and improved function. For information about how to locate a certified matrix repatterning practitioner in your area, please refer to our website under Find a Practitioner. And we look forward to hearing from you.